Okay. So these are the contents of my lecture. I'm going to show you my favorite two quotes about vaccinations, then talk about the vaccination story in Kuwait, the latest updates, and the challenges we're facing. So I'm very excited about health economics. So one of my favorite vaccinations quotes is vaccines are the most effective healthcare intervention there are. Also, we had this problem in Kuwait with the anti-vaccine groups. So I really love this quote. Vaccines have wiped out a score of formerly deadly childhood diseases. Vaccine skepticism had helped to bring some of those diseases from near extinction. So, a wee bit about the timeline of vaccination in Kuwait and the story. So vaccination in Kuwait, as we see it today, had three phases over 3 decades. It was first started by an Emiri law from Sheikh Abdullah Salem in the 1960s, and started as a small campaigns to attack lethal infectious diseases like smallpox, polio, and measles. 10 years after that, Vaccination Committee was established, and it has changed 3 times since then. EPI program was established in 1980, and thereafter there was an assessment every year for a decade, and since 1989, there was a surveillance every 5 years. This is this history of vaccination in Kuwait. I'm not going to bore you with details. I just want to show you that we started with OPV, MMR, between 1963 and 1973, and our latest vaccination added to the schedule were the varicella vaccines and the rota. This is the latest updated vaccination schedule in Kuwait, which was reviewed in 2019 by the Vaccination Committee. As you can see, we start vaccinating individuals before they were born. So we start giving the vaccination during pregnancy, and it continues to the age of 16, 18. Also, we are planning to add the HPV vaccination, 9-valent, to our girls at 10 to 11 years old, at 2 doses at 6 months interval. That can extend to 1 year interval. So, in the National Immunization Program in Kuwait, Public Health Department, the Ministry of Health of Kuwait, is responsible for the EPI program and the allocation of resources, including finances and human resources. The National EPI program adheres to the WHO and NITAG recommendations and follow the national ministerial law and legalization. So basically, whenever we want to introduce a new vaccine, allocate a budget or whatever, we have to have a lawyer from the legal department of the ministry to go through the laws and to avoid parliament's questioning. All vaccinations in Kuwait are free of charge, are given to the local and migrant population, and it includes child, adolescent, and adult vaccines, and they are available in every governorate. We have 40 vaccination rooms between our polyclinics and 33 preventive medicine centers. This shows you the levels of public health and the vaccination, if I may. So the central level is the disease control division, communicable disease control department, and then it divides into multiple polyclinics and multiple preventive medicine centers within the polyclinics and vaccination rooms. Sorry. So EPI program, as I just mentioned, is integrated with other primary healthcare delivery programs in Kuwait. So GPs, family medicine, pediatricians, internal medicine, the physicians can refer patients to be vaccinated. Every new birth in Kuwait, be it Kuwaiti nationality or a migrant population, they will be notified to the public health units and the local preventive medicine clinics within the region. Immunization registry are maintained annually, and the defaulters are tracked and called back. In some cases, though, we have to involve the police, but this is very rare. Usually, if one of the parents is a drug addict or in case of family feud and divorce. The annual shipments are according to national needs, which are provided by the public health head in every district and sent by a report to the directorate. The tenders are either local supplies or through the GCC. Every 2 weeks, vials are sent from the central storage to the polyclinic according to the polyclinic and preventive medicine according to the needs. Cold chain supplies and equipment are maintained annually. In case of an emergency, it will be fixed straight away. Monetary and staffing for immunization delivery is fully covered by Ministry of Health. Mandatory vaccine. Childhood and adolescent vaccine are a must. No child would enter school without vaccination documented. Work and visa permit for expats, and during Hajj season, during outbreaks, which I didn't see in my lifetime. So the vaccination coverage in Kuwait, as we all know, that WHO recommends childhood vaccination to be covered, childhood diseases to be covered, 95% at national level and 90% at the subnational and district level. The coverage level in Kuwait are calculated annually by Public Health Department based on the resident method recommended by WHO. This is, however, is done manually. Then every 5 years, we have a vaccination coverage survey that is done in the directorate. The essential EPI vaccines coverage is more than 95% at a national and subnational level. All the data are collected by public health staff at central, regional, peripheral levels, including the private sector. So basically, we would send teams to private sector to collect the data, and the survey will be done according to WHO guidelines. This table here shows the vaccine coverage in Kuwait from 2000 to 2016. I'm not going to bore you with the details, but if you look at the 2013, you would see that the survey numbers do not match the actual numbers that have been reported in the previous years. This can be done because of the fact that the reports are done annually, which are more prone to human error. Is Kuwait National Vaccine Action Plan aligned with the WHO and global action plans? Well, as you can see, vast majority of the plans are followed. However, we had a problem with measles because of the anti-vaccine groups that are really growing and very loud. Also, we had a problem where some of the doctors, unfortunately, and other healthcare providers, they advise their patients against vaccination. So, incentive to encourage vaccination. We have done health education activities, vaccination week activities, which I'll show you in a wee bit. Seasonal activities, respiratory illness vaccination campaign. It was a huge success for 2 years in a row, and vaccination coverage was more than 80%. Public health activity days and health activities days. These are some of the activities the successful activities that have been done for the vaccination week. Also the respiratory illness. So twice we've done the winter vaccines for pneumococcal and influenza. It was a huge success. I don't have a pointer. So This one here is the spokesperson for the Ministry of Health, and he was there in the mall in front of everyone receiving the vaccine. And we had the involvement of the police academy. It's not clear, and this was open for everybody to attend. Challenges we're facing. We have limited resources, human and financial. Public health in general in Kuwait, we have very few doctors and other public health workers. Also, there is a competing health priorities like NCD. Again, as I just mentioned before, the growing anti-vaccine groups, the resistance to vaccination from physicians and other healthcare workers, lack of electronic registries, and the monthly reported are sometimes inaccurate. The place of vaccination over-reporting, as we just seen in this table a couple of slides ago. These are the stakeholders of the National Immunization Program in Kuwait. As you can see, it has multiple bodies are involved, including the GCC Health Council and the WHO. Plans to improve national immunization program. We are planning to avoid the problem that I've just showed you in the table, where there was an over-reporting. We're planning to have the survey more frequent than 5 years. Maybe we'll cut it by half. We haven't decided yet. We want to improve electronic networking at district, regional, and national level, and we want to use electronic surveillance if possible. We want to invest more in health education about the importance and safety of vaccine for population as well as healthcare providers. Update the National Vaccine Action Plan. As I just mentioned, we're adding the 9-valent HPV. Also, another successful vaccination-related topic in Kuwait, we just started another traveler medicine clinic, which provides coverage and pre and post consultation for travelers in the districts in Kuwait. And we would like to update the operational policy. I'm gonna end my talk with a skyline of Kuwait.